Hi, you guys. So, I'm back with my 2-month update. For some reason, I can't get my life together to record at home, so you're just going to have to deal with these car chronicles. But, I don't have any of my information in front of me, so just like a quick rundown of what I remember, because my memory is all of a sudden horrible. Sidebar, I did read in one of these support groups on Facebook that was a side effect of surgery. Some people have short-term memory loss, which my memory wasn't that good to begin with, so now, of course, it's horrible. But I had my surgery May 14th. That was here in Charlotte at CMC Mercy. That's downtown Charlotte. And my surgeon was Dr. Gersing, and he is a surgeon with Carolina's Weight Management. And I absolutely love him. He was really, really, really good. But while I was in the hospital, surgery went well. I had like some other complications to arise while I was there pertaining to my heart and my oxygen level. So that's what prolonged my stay. I ended up staying like days after surgery. So once they kind of got it under control, like it really wasn't all the way under control, but they said as long as I followed up with the pulmonary doctor, I could go home. So, of course, I was like, yeah. But other than that, I think the first month after surgery, I was down. I started at 275. That was before the 2-week pre-op diet. I got down to 265 last month video, or that's where I started the day of surgery. Last month's video, I was at 245, and now I'm at 230. So I've lost a good amount of weight. I think in the back of my mind, I'm like, maybe I should have lost more, but I don't know. I'm still happy with my weight loss, so either way, I'm good. But not much has really changed since my last video. I still don't eat that much. I still stay away from chicken. I can't digest that. I definitely stay away from broccoli because that is horrible. I drink a lot of diet Lipton green tea. I drink a lot of water. As far as drinks, that's it. I did try to do like green smoothies like I did before surgery. I can't really tolerate that. So as far as drinks, I drink water and the Lipton diet green tea. Food, typically in the morning, I will have the Cliff bars, the protein bars, and that's the peanut butter flavor. I think I shared that in the last video. Lunchtime, I don't really do anything. I'll drink a Premier protein shake, and I'll drink like some green tea or something like that. What else? I typically save food for the evening time. And typically when I eat in the evening, I'll have shrimp or salmon, some sort of fish, because that's about the only thing that I've found that I can really tolerate. Like I don't get sick from it after I eat it. So I eat a lot of fish, and I'm not mad about that. I like fish. I've always liked it. One thing I do want to try again are crab legs. I just want to make sure I still like it after surgery. But other than that, like, as far as food, that's about it. I don't have, like, I don't get anything special. I just kind of stick to what I know and go from there. One thing I did start eating that I didn't like before surgery, hummus. I'll eat that on like a little Triscuit, and that's it. I'll eat like 2 or 3 of them a day, and that's it. Like, I'll be full after that. But and I eat a lot of freeze pops. Other than that, I haven't, I think a lot of people call it the dumping syndrome, or dumping, whenever you eat something and you get sick immediately after. I haven't done that too much this past month, so I'm pretty excited about that. So I think I'm learning how to use my tool and how to sustain myself. What other thing did I want to mention? Yesterday was the only day that I kind of got sick. I think what happened was I hadn't really had any food. All I was doing was drinking. But yesterday on my lunch break at work, I went out to Target, and while I was in Target, it was just like I was shaking really bad. Like, I didn't know what was happening. Like, I got really scared, and I was like, I need to hurry up and get out of here because I don't want to pass out. I felt like I was going to pass out. So while I was in there, I was just like, let me get all my stuff so I can get out of here. But I think what happened, like, once I drank a Gatorade and I had some bread, I was fine. Like, something just happened. I'm sorry. I think it was like a rock or something. But anyway, once I had the Gatorade and the bread, I was perfectly fine. But I think what it was, like, the night before, my husband and I had breakfast for dinner, and I had toast with eggs, and he did like smoked sausage, I think, and I just wanted to try it, which it went down, nothing came up, but I just didn't like the taste of it. So I had like a little piece of that. I had a couple of bites of my eggs, and I took a bite of toast, and that was it. Like, I didn't finish my dinner at all. So I think because I really didn't eat the night before, and then yesterday morning I didn't really have breakfast, which is unusual. Like, I normally have it, but I think because we were so busy at work, I just didn't stop to eat. And then by yesterday afternoon, being out in that 95-degree heat and not eating, I think I was getting sick. But again, I feel perfectly fine now. I'm actually on my way to the doctor now, but everything's fine. I'm just doing like my checkup or whatever. But yeah, other than that, I think everything is good. I think my weight loss is pretty steady. I really don't have any complaints. I know, like, at this point, a lot of people have buyer's remorse and things of that nature, but I don't think I've ever asked myself since surgery, why did I do this? Because I know why I did it. Like, I have a legit reason. Like, I needed to lose the weight because I wasn't able to lose it on my own. Having PCOS, it was extremely hard to lose a pound. But our main goal is to have kids, and I wasn't going to get pregnant being as overweight as I was. So my main goal is to get to a stage where we're able to conceive and have a healthy pregnancy. So I think I have no buyer's remorse at all, but I can understand why other people have it, because if they're not used to feeling a certain way, they're used to feeling fine all the time, I can see why they would ask that. But That is it for this video. I do appreciate all of my new subscribers and all of those who have sent messages and commented on my post. I greatly appreciate it. Please, please, please like, share, subscribe, and I will see you guys in my next video. Bye.